Hi, everyone. Let's see. Oh, we have all our friends coming in. So nice to see everybody. We have Brooke and we have Giovanna. Welcome, everybody. We're just going to wait a few minutes so that way we give a chance for everybody to log in. Thank you for joining us tonight. Hi, Pam. How are you doing? All right. We'll get started here in a few minutes. All right. Let's see, we have Maria that just checked in. All right, we're going to start in a minute here. Just give everybody a chance to log in. How's everybody doing tonight? All right, super excited that you're here joining us. Oh, hi, Michelle. How are you doing? We have people from out of the state, Chicago representing. All right, let's see. All right, we're going to start in another minute here. Thank you all for joining us. How you doing, Lori?
Good, thank you.
Yeah. Are you excited about tonight?
I'm excited.
All right. All right. Give people another minute here to log in. Judy, thank you for joining us. Ashley, welcome. Amy, nice to see you. All right. I think we'll get started here. Thank you so much. Good evening, everybody. Welcome. We're so excited for you to join us for our very first webinar. My name is Susanna Coleman. I'm the assistant manager here at Method Health, and I'm joined by the lovely Lori Jesberger. She's our nurse practitioner.
Hello, everyone.
So we're super excited. As I said, this is our very first educational webinar, and we decided to start it off with a bang: women's hormones, balance, and restoration. So I know when we were putting this webinar together, and I was talking to my friends and family, they were super interested in knowing a little bit more about their hormones. So we have a great program for you tonight, and I know you'll enjoy it. So, but before we get started, I just want to tell you a little bit about who we are and what we do at Method Health. We are a health and wellness center, and we're located in East Fort Lauderdale, though we do service clients nationwide. Our approach is super simple. We know that every person is unique, therefore your treatment is unique, especially for catered to you. So, and we do it in a very easy manner, and it's in 4 steps. First, we do blood work. So it starts with you having a comprehensive blood analysis. Second, we do a consultation. So it's a 1-hour consultation with either Lori or one of our other providers, and they take an in-depth look into your health. And then third, they come up with a treatment plan that is unique to you. And then fourth and lastly, you do a follow-up. So once you begin the plan, you always have access to any one of our providers or medical staff. If you have any questions, it's very much a customized plan, health plan for you. Tonight, we wanted to do this webinar not only to educate you, but also to give you a chance to ask questions. We want you to feel like you're with a group of your girlfriends and you're chatting. because I know when I'm with my friends, we always talk about these things, and sometimes we're like, well, I don't know, or we should ask our doctor. So tonight you have the chance to ask Lori. There's no such thing as a silly question. So please feel free to put your question in the chat box, or you can text us to the phone number right behind me, and we'll do our best to answer your question. If we don't know the answer, Lori doesn't know the answer, we will definitely research it and get back to you. So please, feel free to ask anything that you like. So, and because we've had such success with our wellness program, this is what led us to do this webinar. So without further ado, I'm going to hand it off to Miss Lori, and many of you who are our clients right now have either spoken to Lori on the phone or met her in person. She is fantastic. I've learned so much from her these past few months, not just in the Method Health business side, but also personally in my own health issues. So I thank her tremendously for that. So.
All right. Well, thank you, Susanna. I appreciate that. Thank you so much. And thank you all for joining us this evening. So a little bit about me. I'm a board certified nurse practitioner. I have worked in multiple practice settings over my career, but my real passion for hormone replacement came in 2013 when I personally went through early menopause due to chemotherapy from my breast cancer treatments. So Susanna was saying, feel free to ask the questions because I'm your resource tonight. I've already experienced what we're going to talk about tonight, or I'm currently experiencing. So please feel free to ask those questions. Okay. And then the other thing is it leads us up to today where I get to fulfill my passion with assisting clients here in Fort Lauderdale at the Method Health Clinic with the hormone imbalances. So again, feel free to text or
do the chat box.
Yes, to let us know what questions you have for us this evening. And are we ready to talk about
we're
hormones?
ready.
So,
strap on your seatbelts because it's going to be a bumpy ride, ladies.
All right. So first of all, I think it's best to define what are hormones. Hormones are actually chemicals that are produced in the body that are responsible for basically everything. Okay. They're responsible for the growth, the repair, the maintenance of the reproductive system, along with influencing other body tissues. Okay. And they also contribute to our bone health. Now, hormones, the release of hormones are basically up and down. So day to day, second to second, even hour to hour. And during our menstrual cycle, the different stages, there's going to be different hormones that are released. So I'm certain everyone has heard of estrogen. We're going to talk about the 4 primary female sex hormones. Estrogen is our main one. So estrogen is produced by the ovaries and also the body's fat tissues. Okay. It's responsible for basically everything, ladies. It's responsible for our mood, responsible for energy, motivation, sleep, metabolism, weight, digestive health, bone health, skin health, libido. I mean, that's pretty much everything. Then we also have progesterone. Progesterone is the feel-good, calming sex hormone. That's also released by the ovaries, and it is basically responsible for supporting pregnancy and also balancing estrogen. So with this one, when we're times of stress, we release less of the progesterone. Then the other one, the third one would be testosterone. Yes, ladies, we do produce a little bit of testosterone, even though it's the male dominant sex hormone. This is also produced by the ovaries and also the adrenal glands, which sit atop of the kidneys. And we need this one to promote muscle growth, libido, which is our sex drive. And we also need this for energy and motivation. And then the last one would be DHEA. This is a precursor to other hormones. So it helps to produce more testosterone and estrogen. It's also known as the anti-aging hormone because it produces youth-producing properties. Now, as it relates to perimenopause and menopause, I'm certain we've all heard of these terms, but exactly what are they? So let's talk about that. Perimenopause is actually the transition into menopause. And this typically occurs in our late 30s to early 40s. This is when we start to have a decline in the reproductive hormones produced by the ovaries. And this typically lasts anywhere from 4 to 10 years. Now, many times when we start into perimenopause, we start having irregular periods. That's usually our first sign of something, hey, what's going on? And when we start to have irregular periods, we have to remember that we're still ovulating. So if you're still ovulating, you still have the chance of becoming pregnant, okay? And then there's a flip side to that because there's a decline in the female hormones. Sometimes women do start to experience infertility during this phase. Now, perimenopause ends when we have 12 consecutive months where we don't have any periods. And then that leads us into menopause. So menopause is defined as no menstrual periods for 12 consecutive months. So the cessation of your menstrual periods for 12 consecutive months. The ovaries no longer release eggs. So you're basically, no ovulation is occurring. And the average age is 51 years. Now, typically too, we usually say whenever mom went into menopause, that's typically when you can probably experience menopause. Okay, so check with mom, see when that has happened. And that's, like I said, typically when you will go through menopause. And some of the menopause can result from, like we just talked about, naturally occurring when you have the natural decline, the gradual decline of the sex hormones from the ovaries. Then you can also have menopause resulting from surgery. So those women who have had their ovaries removed, or it's also known as a bilateral oophorectomy, that is going to put you into menopause, and that's going to be abrupt menopause. And then you can also experience menopause from chemotherapy, which is my experience. And then you can also experience menopause abruptly through pelvic radiation. Now, menopausal symptoms that occur abruptly are usually a little bit more difficult to adjust to because, again, it's abrupt. So when you have therapy or pelvic radiation, then you're going to have a little bit probably more difficult time adjusting to those symptoms. Now, I have had patients or clients ask me, how come chemotherapy or pelvic radiation puts you into menopause? And to oversimplify this, it's basically those treatments when you've had chemotherapy or, like I said, the pelvic radiation, it basically severely damages the ovaries where they're just not going to produce the hormones any longer. Now, what are some signs and symptoms of perimenopause and menopause? So basically, this is what's happening to your bodies, the changes that you're starting to notice. Like we have just already talked about, typically these signs and symptoms, irregular periods will be our first symptom, okay? And this can be where you don't have a period for a couple months, or it can be where you're having breakthrough bleeding, or you're even having a couple periods a month, or spotting between periods. And even the periods can last in longer duration than normal. Then we start noticing we're having that weight gain. Okay, weight gain, and the reason we're having this is we're having a shift in our body fat distribution because we're having a decline in our hormones. So the body fat that are typically on our hips, our thighs, are now shifting into the belly area where it's known as the menopause belly. Then we have those dreaded hot flashes where we start feeling that just feeling of heat, like someone has put us in the furnace. And then we typically have like feelings of chills and sweat afterwards. And these can vary. It can last seconds, it can last up to minutes. And typically, hot flashes can last 7 to 8 years, and then 4 to 5 years post menopause. Okay. Now, the other things that we can experience night sweats. We can also then start having mood changes where we start noticing a little bit more anxiety or irritability. We can get depression-like symptoms. We can start even having changes in our sleep patterns where we have difficulty falling asleep. But most of my clients start saying that they have difficulty with like the witching hour. They'll wake up between 2 and 4 a.m. and they have difficulty falling back to sleep. So that we experience that. Then we start, because we're not sleeping, we can have increased fatigue. We can then start having brain fog and the inability to focus, lack of concentration. We can start experiencing dry and itchy skin. And then we start experiencing vaginal dryness. And when you start experiencing vaginal dryness, you can start then having dyspareunia, which is actually painful intercourse. And then it turns into we have a decreased libido or sex drive. Well, as Susanna and I were talking about this, why would we want to have sex if it's painful, right? So again, these are just some symptoms that we can start noticing. And then we also can experience where we have breast tenderness or we have lack of breast fullness. We can also start having joint pain or stiffness even, and that's because when the hormones start declining, it starts affecting the collagen production. So we start noticing we're having the joint pain, and then we start noticing wrinkles or the saggy skin that we start noticing. And then we can also have digestive issues because again, the decline in the hormones cause an overgrowth of the bad GI, the bad bacteria, which can cause like IBS type symptoms like irritable bowel. So we can start experiencing some bloating. We can have some food intolerances, constipation, even diarrhea. Now, some potential health complications that can occur after menopause would be you have an increased cardiovascular risk or heart disease. You can have urinary incontinence, and that is because we're having the relaxation of the pelvic floor muscles. Again, a decline in sexual function. Osteoporosis, which is basically the thinning of the bones, which when our bones are thinner, then we have an increased risk for osteoporosis. Weight gain, which can lead to diabetes and other metabolic disorders. And then we can have vaginal atrophy. Basically, if you don't use it, you lose it. That's the saying, right? So, whew,
That's
a lot.
That's a lot. Is there a light at the end of this tunnel?
There is a light at the end of the tunnel. And we thought this was kind of comical. We all feel like our bodies are hijacked. And yes, when I asked for a smoking hot body, menopause was not what I had in mind. And ladies, isn't it kind of ironic that all these body changes that's occurring, menopause, it begins with the word men? I don't know.
Maybe it's just a coincidence.
It might just be a coincidence. But so how do we actually manage our hormones? So basically, balanced hormones are essential to live in a healthy and happy life. So we're going to talk about some ways that we can help in help improve those symptoms and help to try to balance our hormones so we can get back to living the lives that we're used to living. So some interventions to help with those dreaded hot flashes. Dress in light layers, okay? Make sure that you're trying to avoid heat. And I say that as I live in South Florida, the heat is ridiculous here, but it's okay to utilize a fan. There's no shame in your game to put that fan on your desk and use that. You need to try to avoid spicy foods and alcohol. Try to manage stress, because when we're more stressed, the anxiety will produce, will actually induce the hot flashes. Maintain a regular exercise program and try to consume more phytoestrogen rich foods, which those are plant-based foods that have a higher estrogen concentration. So some examples would be organic soy, tofu, tempeh. Those are some things. And then we're also going to be sending out an email after this presentation, and I'll put a link in there so you can look up some other nutritional facts regarding the organic soy. And then you want to maintain a healthy weight. You want to consume healthy fats, which those include like avocados, nuts, chia seeds, fatty fish. You want to limit those trans fats and saturated fats. Limit the high glycemic index foods. And what are those? Those are those sugary foods. Those are the refined sugars, because sugar actually is a very inflammatory item. So you want to make sure you're not consume them, because it causes inflammation in our bodies, which can increase that joint pain and joint inflammation that we're experiencing. You also want to limit alcohol, because alcohol actually causes vasodilatation of our blood vessels. And what does that mean? It basically causes the blood vessels to dilate. And when they're dilated, then it induces those hot flashes. Take probiotics or eat more fermented food items like kefir, sauerkraut, and tempeh. That's going to help with some of the digestive issues that are going on. You want to make sure you're avoiding smoking. Perform daily weight-bearing exercises, because this is going to help promote your bone health. So make sure you get those 10 to 12,000 steps in daily. Perform daily meditation or relaxation techniques. And this is, again, to help manage that stress and to promote your mental well-being. Use water-based over-the-counter vaginal lubricants. This is going to help the vaginal dryness. And then make sure you're consulting with a healthcare provider to determine if you are a candidate for treatment. Again, menopause is diagnosed based on the cessation of menstrual periods for 12 consecutive months, along with symptoms. A comprehensive blood panel may also identify potential other reasons. Symptoms. For example, you might have thyroid disease. Again, you might have diabetes. So the blood panel can definitely determine what's going on. And then if you are a candidate for treatment, maybe consider bioidentical hormones. What are bioidentical hormones? These are custom compounded hormones that are made at compounding pharmacies. They are compounded to be more like our natural occurring hormones, and they come in various forms. So for example, I use the topical cream. So there's a topical form. We also have pills, which is the oral form. And then we have sublingual, which those are troches that go underneath your tongue. And there also are injectable forms. And then we're wondering, how can we actually enjoy this process? So again, I think what this comes down to many things. When we have a positive mindset, basically we know menopause is inevitable, ladies. We're all going to experience menopause. Okay, so if we basically accept that this is what's going to happen. So again, the positive mindset, we need to remember that menopause is not a one size fits all. All right, each woman is different. It affects women differently. So for example, Susanna here, she may have mild to no symptoms, where I may have severe symptoms. So make sure you're paying attention to your bodies, okay? And visit a healthcare provider to talk over your symptoms and the changes that are going on. Inform yourself as much as possible. and give yourself that time and patience to learn about your changing body, just as you're doing tonight. I hope you're taking notes and you're writing down, oh yeah, I might be experiencing this, this, and that. So you can have that conversation with a healthcare provider and communicate with your immediate family members. Okay. You don't have to go through this alone. So basically when it's the middle of a snowstorm and you have your bedroom window open, communicate why you have that bedroom window open. Okay. And then especially when it comes to the intimate relationships as it relates to the decline in sexual function because of maybe possibly the vaginal dryness and the difficulty with the painful intercourse. You want to have those open conversations with your significant other, okay? Obtain that support system. And then we need to remember to set boundaries. We as women, we multitask, okay? We're known to multitask. We feel like we have to do it all. It's okay to delegate. This is a prime time to delegate because again, we need to manage stress and we always feel like we have to do it all. And again, we don't have to do it all. Our plates don't have to be overflowing, okay? We don't always have to be that yes person. But most importantly, through this all, we need to make sure we're kind to ourselves for this journey. And remember, the process is the reward.
That was great, Lori. Thank you so much. So before we get into your questions, we do have a couple of frequently asked questions that we get here at the clinic. One of them being is, okay, so let's just say you want to start this journey. What if I don't live in Fort Lauderdale, or, how am I still able to do this? And the answer is yes. So we do have a mobile phlebotomist in basically every state. So if you are interested in starting this journey and really getting to know more about your health, then you could give us a call and we can schedule someone to come out to you, whether it be at home or at place of work. It's super easy, takes about 5 minutes. And then once you get your results, then either Lori or one of our others can give you a call. So next one is, Lori, do I have to do this therapy for the rest of my life?
Okay, so that's a very good question. So it basically depends. Again, like I said, everyone is different. So it depends on what your treatment plan is. Okay, so depending on that, you don't necessarily have to do it for the rest of your life. I typically say, especially if it's related to hormones, if you want to remain symptom-free, you remain on the hormones for that time.
Okay, great. The next one is COVID and hormone health. Is there any sort of relation between that, or?
Okay, so hormone health, as long as we have our hormones balanced, our immune system is optimal. So when our hormones are in balance, we don't have an optimal immune system. So with that being said, we have an increased likelihood to contract not just COVID, but any other kind of illnesses as well, because our immune system is not optimal.
Right, and that makes sense. That makes sense. And what other therapies do we offer here? So besides our health and wellness program that we've described, we also do nutrient IV therapy. We have weight management. And if you have a chance at the end of this presentation, we'll have our website. Please feel free to check it out. If you have any questions, you can give us a call, and we'd be more than happy to get into it a little bit more with you.
I'm going to add just a couple other therapies that we do here at Method. We also do Botox, and then we also do peptides, which peptides actually help to promote the growth hormone. And when you enhance the growth hormone, you produce a leaner muscle, you decrease body fat, and it also promotes sleep. So we do have those options as well. And then as it relates to the IV therapies, when we actually look at when we analyze your labs, we can determine if you are deficient in certain nutrients, and we can actually supplement those nutrients in the IV therapies that you're receiving.
Okay. And then one of the last question is, how much does therapy cost? So it treatment, it depends on the treatment, but basically we have the blood draws, which is covered under most insurances, and then you have your consultation fee, and that can range anywhere from $89 to $150 depending on the provider. And then once your provider has determined your treatment plan and what hormones, if necessary, or any supplements, perhaps you're deficient in vitamin D or you want to control inflammation. So it all is dependent on that. But for today, for all those that have joined us this evening, we have a great special. We're offering a free consultation along with the first month free. So it's a great deal.
You can't beat that deal.
No, because at least it'll give you a starting point as to where you're at, you know, what your red and your white blood counts. That's some of the things that we test. Your thyroid,
Cholesterol,
your cholesterol, your insulin, and your sugar. So it's all those things that a lot of those tests that perhaps your primary practitioner doesn't run unless you ask for it. So it's really a good.
And we also do cardiovascular markers.
Correct, because it is Heart Health Month. So it's always a good time. It's a good time to see how you're doing with your cholesterol. Okay, so let's get into some questions. Let's see, we have a question from T. Reyes. Thanks for submitting one. And I really like this question because I have this issue with inflammation. So I know you talked a little bit about inflammation and is it a part of menopause or does it increase with menopause? And if so, what can we do to kind of
great
control
question.
that?
Great question. So basically, yes, the inflammation does increase because as the hormones start to decline, the collagen, there's less collagen produced. And when there's less collagen produced, that's what basically helps to lubricate our joints and our skin. And so that's when we start developing the joint pain and the stiffness. And we also have dietary supplements that we didn't mention in our what we do here at Method. So we have high grade supplements, and we often prescribe different ones to help with that inflammation, whether it's turmeric, whether it's boswellia, that will help with inflammation. And again, the weight bearing exercises also promote.
Right. And I can attest to that. I myself have rheumatoid arthritis, and I am on biologics, but I also have been taking turmeric. Lori also recommended the boswellia, and so which has helped out tremendously. I tend to try to go as more natural and homeopathic as I can, but unfortunately, I still have to combine that with my biologics. So I think that combination has served me well. So, okay, we have another question. I heard B12 helps with weight loss. And do we offer that? And that's from Brooke.
Yes, Brooke. Thank you for,
hi, Brooke.
Yes, hi, Brooke. So yes, B12 does help. And we have what we call the Skinny Method injections here, and it's B12 along with carnitine. So it does help to suppress the appetite and give you energy to promote the weight loss.
Okay, great. Next question is, how long does it take for therapy to work?
Okay.
Is it going to be like next day, Laura?
No. We talked about this. So basically, we are a society that's instant gratification society. That does not work well with hormones. Okay. It takes a little bit. When I say a little bit, it can be like 2 to 4 months. So when we start you on hormone therapy, you always start lower and work your way up. So when we start that, we'll check your labs again in 2 months, and we may need to tweak or titrate those hormone levels to get you to an optimal level. So it is a little bit of a process, but typically by 6 months, people are feeling better.
Perfect. And we have a question about sleeping, and I've had this problem too, waking up at 3 a.m.
Yes.
So
the witching hour.
Right. So again, what causes that, or how is that, or how can I help to kind of get through the night?
So basically, the drop in estrogen and progesterone is what's causing that. So typically what we do is start the estrogen, start the progesterone, and then people start to notice that they're going to start sleeping through the night.
Okay, great. And if you have an old mattress, you need to buy a new mattress. That will help you as well.
Yes, mattresses that are older than 10 years, replace those.
Exactly. It's the simple things. All right. Well, thank you so much, Lori. It's been fabulous. I'm so happy we got to do our first webinar.
So am I.
And thank you all for joining us. We are very appreciative of all our current clients and all our friends that support us every day. As women, we need to support one another and be there for each other. And like I said, we are here for you. If you have any questions or if you would like more information on our program, please feel free to give us a call. We'll also send you an email with the links that Lori had mentioned earlier in the webinar. Again, thank you again and have a great night.
Thank you.
Bye. See you soon.
Bye.